Welcome back to CTV Morning Live. Time for our Healthy Living segment. Steve Brown joining us, the president of the Family Physiotherapy Center. Great to have you on the show. And joining him today, we have Sandra Charles, who's a pediatric therapist. We have a wonderful young gentleman named Ryan and his mom, Danielle Byrne, joining us this morning. All right, so we're talking, you got your 10 facilities, you've got so many opportunities for people to come to see you, but also the ability for people to head into homes, not only for the elderly, but also for children.
Yeah, it's a great way in terms of if people are not able to come out in terms of the wellness centers, we'll come to them, and especially in this case, and bringing in our specialist physiotherapist in terms of with pediatric physio, Sandra. It's wonderful work that she does on a daily basis.
This is the work that you do. You head into people's homes. Give us a quick breakdown of what it's like working with pediatric therapy.
Well, most of the kids that I work with, I usually start at quite a young age. Often the kids are diagnosed either as babies or as toddlers, that they have some sort of movement impairment, some sort of disability or issue with balance, impaired gross motor development. I started working with Ryan when he was about 3, and he's now 8 years old, and we work on various things. I'll give you a few little things that we're working on getting him walking. Ryan uses a wheelchair for some of his mobility, but he's out now actually standing independently for short periods of time and using a walker as well to walk.
Danielle, has the work that Ryan's been doing with Sandra helped in terms of even him being able to get out of the wheelchair and being able to have some mobility on his own?
Yes, definitely.
It's how you can see it.
Yes.
Now the work is different. You probably meet up with him about twice a month. So there's exercises that you're doing frequently. Is it tough for you to then be able to repeat some of the work, or that's the challenge right there, is trying to do and replicate that?
It is. I find it difficult. Plus, Ryan isn't as responsive to us because, as parents, it's harder to make them do it. But he still does really well.
Now, Sandra, will you take us through some of the work that you're doing with Ryan right now?
Okay.
And it's I'm trying to
called Cri du Chat syndrome.
And what are we dealing with Ryan?
It's a developmental chromosome. He's physically and globally delayed, or what they call global delay, physically and mentally. So we have various issues, health issues. He's actually pretty good with them, but our biggest struggles with him is his mobility, and he's nonverbal. So we go through physiotherapy with him and trying to get him to be able to gain some kind of independence.
So what are you doing here, Sandra?
So one of the characteristics of the syndrome that Ryan has is he has very low muscle tone, which affects his ability to activate his muscles and to stand upright and hold himself up in a standing or various challenging positions. So some of the things that I work on are normal developmental sequences that most kids go through, that we're basically just trying to get Ryan to strengthen and go through these normal developmental sequences. So this half kneeling position forces him to work his trunk in a
I'm going to just put the
position.
mic here, yeah.
This is one of the developmental steps that we need to have and kids need to have before they can stand and walk independently. So you can see he's got a nice upright posture. I'm giving him a little bit of support through his leg. And from here I'm going to facilitate him to come up into standing. See how nicely he does that? Yes. He stands up. And I'll give you a little look at how great his standing balance is getting. So Ryan had hip surgery 2 years ago. His hips were dislocating because his muscle tone is so low. So they basically put some pins and plates into his hips so that he'd have better hip stability. And a lot of these things that I work on are designed to try and improve the strength and stability around his hip and around his core. So I'm giving him a little bit of support through his legs right now, but you can see how nicely he's working on standing.
Is it rewarding for you to see the milestones that your young patients are able to achieve?
Yeah, I always say I have the best job in the world, and the kids and the families that I work with are just phenomenal. And most of the families, like I said, I start working with the kids when they're quite young and often work with them until they're, 20, 21 or
That's amazing. Steve.
However-
Nice job, Ryan.
Excellent.
Well, see
You're
if we
doing
can show them how we
great.
can take a couple steps. Let's see
He's
if we can
doing
do
great.
a few steps.
We're
Ryan.
gonna, can you take a couple steps as we head into our commercial break? And of course, Steve, always tons of information for people who are looking, you know, at finding people like Sandra to be able to head into their homes and work with their children. There's
us a
always
call.
to give
Yeah.
you a call.
Yeah.
There's always an opportunity. There's
You
always
got it.
something that
We
can
don't
be
turn
done.
anyone away.
Great. Steve, always a pleasure. Sandra, congratulations on the work that you're doing. And Ryan, you're doing awesome. Danielle, thank you so much for sharing your story. We're going to take a commercial break. We'll be back right after this.
Driving